forward to welcoming you to our hospital's international courses.
We are delighted to launch the first international educational program series at Imam Reza General Hospital, Tabriz, Iran.
Tabriz is a historical and vibrant city.
You will love our beloved city.
Join us for our educational programs.
We'd love to have you here.
Waiting for nice days together.
See you soon!
Hello everyone, I'm honored to host another guest to introduce one other course of the educational international courses provided in Tabriz University of Medical Sciences, Imam Reza Hospital. I'm very honored to host Dr. Amin Sadrazar today from Department of Gastrointestinal, and thank you, Doctor, for being present here in this studio, in COVID studio, talking about the course you are providing. First of all, I would like to ask you to introduce yourself and talk a little bit about your field of activity.
Thank you. In the name of God, first I would like to thank all the management staff of Tabriz University of Medical Science, especially you and your team, for designing the international educational program of Imam Reza General Hospital. And I am much pleased to be this program today. I'm Amin Sadrazar, Assistant Professor of Gastroenterology and Hepatology at Tabriz University Medical Science. I graduated in General Medicine in 2010 and in 2014 I obtained the special board at Internal Medicine, and in 2018 I succeeded to obtain the subspecialist board of gastroenterology and hepatology. My favorite field in gastroenterology is functional and motility disorder. So in 2019 I completed the supplementary course fellowship in movement disorder of gastrointestinal system, with emphasis on the interpreting and performing of high-resolution manometry, esophageal and anorectal at Shahid Beheshti University of Medical Science at Talgani Hospital.
Very good, very good. Thank you. Great. Would you please explain a little bit more about the subspecialized field of activity you are acting, the motion disorders in GI system?
Gastrointestinal disorder in general classified as two main groups, structural disorder and functional disorder. Structural disorder diagnosis and treatment almost straightforward, but diagnosis and management of functional disorder is confusing and challenging for the physician and the patient. Functional disorder of gastrointestinal system divided into main categories: upper and lower GI disorder. Upper GI functional disorder included the achalasia, distal esophageal spasm, gastroparesia, and the lower GI functional disorder is included the IBS, functional constipation, and fecal incontinency.
Very good, very good. It's really a complicated field of diseases. And in part, we urologists share something with you, especially in avoiding dysfunction and especially in the field of congenital disorders. There are some collaborations between us, and I'm very happy to have you today here.
Exactly. Pelvic floor disease.
Exactly, pelvic floor diseases and some parts of mixed incontinence. I mean, both urinary and. What about your department? Do you like to very briefly talk about your department?
In G department, we have a GI ward and complete and equipped endoscopy ward. We have also multiple subspecialty clinics such as celiac clinic, IBD clinic, cirrhosis clinic, and functional disorder clinic. In G department, we have the possibility to offer a short-term GI training course such as IBD course and cirrhosis and liver disease course and motility course. We can offer this course to Persian, English, and Turkish language. The minimal qualification to enter this course to have a degree in gastroenterology.
Very good. I was interested to know whether you were talking about the course you are providing or some of the other courses. I mean, we can go straight to your own course that you are providing. What's the title of the course and what is the features, the content, whatever?
The motility disorder and functional gastrointestinal disorder course, in order to achieve to set goals in the field of functional disorder, we will hold a 2-month course. The 2-month course can be held continuously or intermittently in 2 1-month course. After 2 weeks, the participant can be hand-on. First course in first month, the performing and interpreting of esophageal high-resolution manometry and pH metry. The purpose of high-resolution esophageal manometry is to measure the pressure of the esophagus when at rest and when you swallow. This pressure will tell us if your esophagus is working normally. The most common uses for this test is the diagnosis and management of esophageal motility disorders such as achalasia, distal esophageal spasm, ineffective esophageal motility disorder, prepared for and follow-up of anti-reflux surgery, evaluate of non-cardiac chest bend, and evaluate of non-mechanical dysphagia. The second course in the 2nd month, the performing and interpreting of anorectal high-resolution manometry and biofeedback training. The most common uses for this test in the evaluation of functional constipation, fecal incontinency, and evaluation before any anal surgery.
Very good, very exclusive, and a wide range of knowledge and a cutting-edge knowledge indeed. Thank you. I'm so excited to hear that you provide this. About the length of course, you told us that it is a 2-month course, but I'm curious if a participant wants to extend the length of course based on his or her own needs. Is it possible to increase the length of course, for example, to work with more patients, have more experience?
The course is, the time of this course is the 2 months, 2 months continuously or intermittently in 2 1-month course. This course, the participant can be perform and interpreting of high-resolution manometry on the patient, and they can be go to the subspecialty clinic and visit the patients.
So you think 2-month course is quite enough to be okay, very good. And who is eligible for the course? I mean, should they be only gastroenterologists?
The minimal qualification for this course is the degree of in gastroenterology.
Very good. So, and you told us that the course is hands-on and the participant will be involved with it.
After 2 weeks in any course, the participant can be hands-on.
Very good. Very good. Thank you. I think it is a good amount of data about the course. If you think that there is something missing, you should add to what we talked about.
No, thanks. That's complete.
Very good. Thank you. Thank you for following us in this series of videos talking about the educational courses. I'm very happy that we finished another conversation with a very young academician in this hospital to obtain more data, more information about this course and other similar courses. Please follow us on the website and please contact with our expert team via the emails, subtitles below. And finally, thank you for watching.